I was hoping to back out too and just get your general advice for digital health startups and your take on the ecosystems, and you having been on both sides. So I really love your perspective on, gosh, what is a healthcare disruptor or innovator? These terms get tossed around, and I'm just wondering if that definition has evolved in your journey from doctor to entrepreneur, advisor, etc.
Uh, that's an interesting question. I mean, I thought the word, there's so many different words. Like I was talking to someone else the other day and I said, well, are you an entrepreneur? I said, well, I was an entrepreneur and then I'm an entrepreneur. I'm in a company now, but and they're like, oh, did you get acquired? And I was like, well, no, not yet. We're early in that. He's like, oh, so you're not an entrepreneur. And I'm like, okay, well, I mean, I mean, maybe, I guess if you can define it that way. I think a nice, like a word that probably fits it would be like an innovator, a physician innovator, because it's a little bit neutral or can involve both of the spaces. And whether I'm thinking about an intrapreneur or an entrepreneur and being on both sides, I think that encompasses a little bit of all of that. The other phrase that I like is also the word about being a positive disruptor. And, with disruption, you're kind of challenging the status quo and trying to, you can be taken two different ways. You can be a disruptor and be the person that complains a lot and is negative and you're trying to burn the place down. But, if you're a positive disruptor, you're trying to actually improve things, and I kind of like that, to use that term personally. You're trying to bring positive disruption to healthcare. Because I think it tries to change. You want to change the things about the system that don't work, but do it in a right way, and always have like an attitude of like, we're going to make things, but the things are hard and maybe they're not working, and we're going to make it better. And like when I see a lot of my colleagues are like, oh, this is broken, blah, 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 and then they stop. I'm like, so what are you going to do? Well, I just wanted to point out, it's like, yeah, everyone's, it's like, I mean, that's the difference between, I think being like an innovator or someone that's actually changing things, and then just another person in the crowd or the peanut gallery that's like complaining about how broken things are. It's like, it's hard to go out and do those things, right? And you may not do them and you're going to fail, and you put yourself out there, and it's, there's reputational risk, and it's like, it's hard, but that's what actually changes the world, right? And I think being an innovator is actually, at the end of the day, it should be about trying to do that, or trying to change a piece of the world and make it better. So you have to try. So I think positive disruptor is like, that's a little bit like why I like that term. There has to be a recognition, a plan, and then you got to do something about it, because otherwise you're just, someone
you're just recognizing.